Okay, good morning, everybody, once again. I would first of all like to start the day by wishing everybody a very happy new year. Not because I'm late in wishing, but because today is the Tibetan New Year. And for those of us who are Tibetan, but it's a very auspicious and festive occasion. But here I am giving my presentation and working this whole week. Okay, I'm very glad that the DG doctor are actually stressed on gender and women to show our impact because although we talk about gender, we will be stressing a lot on women because, as you know, because of the system-wide inequalities in most of the societies which are operated in patriarchal systems. So women are on the lower rung in all the fields. So gender, I will be talking about the progress that's been happening at the CGIAR level on mainstreaming and integrating gender, and also at our CRP levels and what is we are supposed to do to get us on board on the gender, mainstreaming and integration, and how can we bring this on board in our work plan from tomorrow. At the CGIAR level, so I'll go from the CGIAR level and then to the CRP, and then what can we do in our work plans from tomorrow onwards. So at the CGIAR level, the CGIAR Strategic Results Framework, which is completed and developed in 2001, identifies that gender is one of the most critical areas if we are to achieve the 4 systems level outcomes that the CGIAR has labeled, that is the food security, reduction of rural poverty, nutrition and health, and sustainable management of natural resources. So if you are really to achieve this and show impact on this, then gender is an issue or a dimension that has to be addressed by all of us in our CRPs. And it also conceives, the SRF, that's the Strategic Results Framework, also conceives that gender is a very cross-cutting theme which can cut across all the CRPs, because there's a lot of synergies that can happen. We can collaborate on a lot of fronts, which we'll be talking about later more. And then going on from that, so the CGIAR has this new result-oriented approach. So if you are really to achieve that, then we need to have established a very robust and properly resourced capacity to address gender, especially since we are working on agriculture. Now, because of this, for the first time, at the CGIAR level, consortium level gender strategy has been developed in 2012, which commits to 2 very important things, as you can see. One is to deliver research outputs with measurable benefits to women farmers in our target areas, and that's within 4 years of the inception of our CRP. So by 2015, we need to show these benefits. And second is to ensure the deployment of quality scientific talent to do this for this purpose. So we need to have either in-house capacity building, recruitment, partnerships, strategic partnerships, so we can improve this, have this capacity. Now, what are the specific outputs that are to be produced as the CGIAR has foreseen or looked at it? One, there's four very important ones that has been pointed out. That is, we have to, all the CRPs, although I've written CGIAR, it's too long to pronounce, so I'll just say CRP. The CRPs, we have to implement a very high standard of gender analysis and gender research, and this has to be mainstreamed in the CRPs and in our centers by 2015. So that means we need to start working and integrating gender from right now in our work plans and actually implementing these. Second is there's a consortium-wide policy on the standards, like how is each CRP, each center doing the gender. So there has been developed a quality standard to actually look at our performance. Then the third one is the high-level quality of gender and agriculture research capacity in all the centers and in all the CRPs. And this can be, as I said, either by recruiting more gender specialists, more social scientists who can do that, or by training in-house capacity building of non-social scientists to do at least the basics of gender analysis and social analysis, and by also fostering some very strategic partnerships, and not just only with our NARS or only with the CG systems or centers, but also beyond that who has expertise on this. And then, of course, to deliver the gender responsive research outputs with positive impacts to gender inequality, benefiting at least, this is the number we have to go by, 1 million women in our CRP areas by 2015. So that's something we need to keep in mind, that's the goal, and we need to dribble the ball along. Then, so what are the critical steps that we need to take in order to be successful in this? One is to recruit gender specialists, because many of the, actually, this was developed when the CRPs were still being written, and even now, many of the CG centers and the CRPs still have limited capacity or limited staff to do this. So we need to recruit more gender specialists and social scientists who can do that. Second is, of course, related to that, improve the capacity of using gender research and gender analysis, even among non-specialists, because most of the CG centers, we have a lot of physical scientists, biophysical scientists, so at least those who, the capacity, they should be trained, they can do at least the basics of gender and social analysis. And then again, as I said, collaboration across the CRPs, across programs, because again mentioned, in all the 15 centers, the capacity for actual gender research is quite limited. So in order to bring this together, to build onto that strength, and we need to collaborate. In fact, these steps have been taken for this by the formation of the CG Gender and Agriculture Network, where we have committees looking and doing these things about capacity development, shared research sites. We will actually look where are these hubs where the CRPs are working in certain areas. Can we share the work over there? And even the methods of M&E is being developed, so which can be shared across the programs and the centers. So everybody, so actually it can be looked at compare our results and also the quality standards. First is sufficient funding. This has been a major point, that all the gender work, all the gender research has to have a sufficient fund allocated for that. It's not that it's under one product line, as we talk about in our CRP, okay, it's there. But no, there has to be specific funding that has to be allocated to do gender research under that product line. Then the consortium level has also come about with a very clear and enforceable accountable mechanisms. They have designed that, and these are these three things, that is monitoring. There'll be monitoring, there'll be an annual monitoring from the consortium office on our gender strategy results. Have we done what we've promised? Have we achieved that? And do we have the budget allocated for that work, that activities, the results? And do we have the capacity? Have we recruited enough? Have we partnered enough to have the capacity to do that work? And this gender performance scheme has been developed, which has been actually now circulated to all the centers, which gives all the details of how this monitoring is going to be done. So some of the key procedures that the consortium is going to take to look at this monitoring and see that gender is being mainstreamed and integrated is that all the CRPs have to have a minimum of two things. One is an approved gender strategy, which we are working on, and in the two CRPs we're leading on the grain legumes and the dryland cereal, we are, I can say 75% of the work has been done. I've been continuously in touch with the senior gender advisor of the consortium office, and she's been giving feedback. So we are quite more or less there, and the DDGR is updated on this situation where we are right now. And we also have to have a work plan from beginning this year, and this year's work plan has to go to the consortium office by 16th of February. So very less time, and I'm just looking forward to this workshop, or dreading also in a way, because I have to collate and take that out by Friday evening, and Saturday I get to send it to the consortium office, along with the budget. And that's where I think I'll be needing a lot of help from our financial department, pestering them. And the second is, again, as I said, there'll be monitoring about the implementation of a CRP, gender strategy. And in case the consortium office, when they monitor, find that it is below the standard that we have promised, then there's going to be a feedback from the consortium office taking, where is it that we haven't reached, what are we supposed to do? And despite that, if we still do not do that and not, then there's going to be saying, a circular will come saying they are dissatisfied with this center or with the CRP. And that could prove, as Rajesh had pointed out later, CRPs are all based on performance, the funding is based on performance. So the impact is on the funding, which can be cut back. And so far, the steps taken at the consortium level is, as I said, senior gender advisor has been recruited, who's been advising all the focal point, gender focal points in all the centers, CG centers, while we're working with his work plans, with the gender strategy, and even she'll be helping us in the capacity building whenever we require. And the other is, as I just mentioned before, the CG Gender and Agriculture Network has been established. The first meeting we had in March, on March 12th last year, immediately after I joined. And then we had a second meeting in July last year. Now we are having the third one to work out more with the monitoring and evaluation and the quality. That will be in June. And all this, and then of course, as I said, the gender performance scheme has been developed and it's being circulated. So what does this mean to us? What does all this mean to all the CRPs and all the centers? It means that this year, from this year onwards, we have to we make sure that we engage in the implementation of our gender strategy research. And there is no question that we can say, oh, this year we are not going to do gender. It's already too late. We're going to do it next year. So there is no question of opting out from integrating gender in our programs. Now, at the program level, at our CRP level, at our center level, what is it that we have to do? Certain key actions that are mandatory that all of us do. One is we have to have, as I said, an explicit gender strategy, and which integrates attention to gender inequality into the main program, say if it's the dryland cereal, main program of the dryland is the main agenda. And also conduct a strategic gender research in order to overcome the crucial obstacles towards a more gender equitable sharing of the benefits that we bring from the program. And this gender strategy, I'm sure most of you have seen that short, I think it's a page and a half in the CRP proposal. I'm not talking about that. It has to be a standalone gender strategy which contains all these rationale, the goals and objectives, product line wise, strategy component wise, whatever it goes along, with a theory of explicit theory of change and the impact pathway. How are we going to monitor this, our own gender component? What is the budget under each product line, under each activity? What is our team? What's going to be the management structure who's actually going to see that this works out? And what is the capacity we have, and what more capacity do we need? So as I said, we are quite advanced in this, excuse me, of this completion of the gender strategy. And also there's a very formal procedure of submission and approval of this gender strategy. So it's not me, Chanda, or the gender specialist, whoever it is, who gives this strategy to the consortium office. It will be the CRP director who will send it to the consortium office, to the chief science officer, with a copy to the CEO, and of course the senior gender advisor. Then since the senior gender advisor is the one who knows the ins and outs, what's been happening, she gives feedback to the CSO and the CEO, and then the formal approval will come through the chief science officer to the CRP director, and then we know it's got approved or whatever may be the case. And this gender strategy has to be approved within 6 months of the inception of our CRP. And since ours is in, I think, October, if I'm right, then by April latest, we have to get it approved, which I'm quite definitely is going to be approved by then, maybe before. But not only approved, but we also need to actually start the work. That doesn't mean that we don't start the work now. I mean, let's wait till April and then we'll do it. But we need to get the ball rolling from now on. And then we also have to, as I said before, I mean, a lot of these are also repetitive because I'm repeating because now it's for us to do it in our CRP, in our center. And so it's kind of banging it on. So we have to make an annual program with a budget. So starting this year, 2013, which I said have to go to the consortium office on the 16th of February. And the responsibility has to be to all. It's not the gender team, gender focal person who does the gender, but since it has to be in all the activities, so everybody at all levels of the organization have to be engaged in that. And then we need to, of course, address the need for capacity. in our CRP, in our center, do we need? How much more capacity do we need? And how do we go, whether it's recruitment, or whether it's in-house training, or whether by partnering with institutions and centers who have this capacity. And then, of course, again, the budget, very, very important. We need to make it a practice. It's institutionalized that every time gender activity is shown there, there's a budget, explicit budget for that activity, for that research. Then is to, again, this again goes on to impacts, to show that, I mean, why are we doing that? Of course, to show some kind of impact, improvement in the lives of men and women, especially women who are more marginalized. Bring a demonstrable, and this impact, the change has to be measurable. Benefits to women farmers. 14 years, 4 years, that means maybe 15 to 16. By 15, actually, 4 years was counting from last year. So from here is 3 years. So by 2015, we did need to show some measurable benefits that has gone to the women through our programs. And by next year, we have to show that we have capacity to do gender research, gender analysis in our CRP. And again, whichever way, collaborate, it can be all these ways. And by next year, we cannot say by the next of it, we still need more capacity. We don't have, and then again, collaboration with the gender researchers, which has already begun, as I already mentioned in the beginning, prior to this, because of the CG Gender and Agriculture Network. Again, this is to, sometimes a lot of duplication happens, the CRP on maize is doing a lot of things which are similar to us because we are all commodity based. So maybe we can take from them and we give ours. So there's a lot of these chances where then we do not duplicate, nor do we even fragment the effort. So these efforts are already underway. And with the CG Gender Network, we've already identified 4 cross-cutting themes on gender across the CRPs. One is on the value chains, the adoption, technology adoption, the gender transformative approach, and the other one is nutrition. So in 2 of these, we are taking the lead. That's the value chains and adoption. We are taking the leads along with rice and the maize program. And nutrition also we are part of others, but for leading we are doing, because value chains and technology adoption is so very important for our CRPs, dryland cereals and green legumes. Okay, so that's the thing. And then, of course, performance monitoring by ourselves. We have this whole M&E section in our gender strategy. So it has to be not only performance monitoring from the consortium office, but from also within our management structure. Okay, now the work plan. Okay, work plan. This is just kind of a example to help us when we do our work plan, which if people need, I think I can distribute copies of this, which I'm going to show, because our outcomes, since we have to show measurable benefits within 4 years, we have to make sure that the outcomes are what we call the intermediate outcomes. And what are some of these outcomes? What are the gender sensitive indicators for such outcomes? I have given it, this is just the major 3 indicators that overall that looks upon the extent to which women are involved or not involved in agriculture or the crop, the grain, legumes, or the cereals because of a program. Have we displaced them? Have we enhanced their capacity? What have we done? Second is the gender disparities. Has it reduced because of a program, and how? And thing is improvements, and this is the nutrition. So this is a list of it, which I'm